Bismillahirrahmanirrahim. Alhamdulillah wa salatu wassalamu ala Rasulillah. Um, my name is Dr. Islam. I am ER consultant. Today our topic is to discuss how to properly code the underlying cause of death in the death certificate. As we receive some comments on how to select the proper code for the underlying cause of death, we need to clarify some points. First of all, the definition. We have three types of causes in the death certificate. The first one is the direct cause of death, which is the final complication resulting from the underlying cause of death occurring closest to the time of death and directly causing death. Or, in other words, it is the final event happen to the patient immediately before death. Okay, so this is the direct cause of death, and we are not going to discuss this point in details, as our aim to discuss the underlying cause of death. The second cause of death is the antecedent or intervening or the intermediate cause of death, which is a disease or condition that occurred as a result of the underlying cause of death but was not the final complication or immediate cause of death. Actually, this type of causes is usually put as underlying cause, and it is not the underlying cause. Most of the physicians are selecting this cause, the intervening or intermediate or antecedent cause, as the underlying cause of death, but it is not right. Something like patient with died with pulmonary embolism, and the underlying cause is DVT, deep venous thrombosis. The deep venous thrombosis is the antecedent or the intermediate cause, not the underlying cause. Okay, so if we can realize that the intermediate cause is obvious cause, the direct cause or the immediate cause is an obvious cause also, the underlying cause is less obvious or deep cause, root cause for the process of the complication leads to death. Okay, so the underlying cause is the condition that triggered the chain of events leading to death, temporarily the most remote condition. Okay, so the deep cause of death, the starting point of the cascade of events leading to death, or the hidden real cause of death that cause the whole process leading to death. This is the underlying cause. So if you think the patient died with pulmonary embolism, the pulmonary embolism was resulted from untreated DVT. What is the cause of the DVT? This patient may have longer recumbency. What is the cause of longer recumbency? Fracture femur or fracture leg, something like that. So the fracture leg or the fracture femur is the underlying cause of death. This is the trigger, or this is the event started the process of events leading to death at the end. Okay, it is not the DVT. This is one example. The direct cause of death is pulmonary thromboembolism. The intervening or antecedent cause or intermediate cause is deep venous thrombosis, as we said, DVT. Then immobilization or longer recumbency is another sequence or another intermediate cause, and the underlying cause is fracture right femur. This is the correct sequence. So don't be confused when you are selecting the underlying cause. It is not an obvious cause. It is not a part of the process. It is the starting point of the process. Okay, another example. Patient with upper gastrointestinal hemorrhage. This is the direct cause of death. He died from extensive hemorrhage, upper GI hemorrhage. it was one complication of the intermediate cause is esophageal varices, and the esophageal varices resulted from macronodular liver cirrhosis, and the liver cirrhosis was a result of the hepatitis B infection. So hepatitis B infection may be a source of the cascade, but it may be 10 years ago or more than 10 years ago, and the patient died now from extensive hemorrhage, upper GI hemorrhage, but the cascade was started by the hepatitis B infection. I think it is now it is clear. So if you have the process happen in the hospital, the full process happened from admission to death. The patient started to have severe bleeding, and the severe bleeding caused severe anemia, and the patient was tried to be resuscitated by blood, and the patient did not respond, and finally he died from acute heart failure or something like that. Okay, so the bleeding is not the underlying cause. What caused the severe bleeding? The accident. The accident is not the cause. It is not the underlying cause. What caused the accident? The accident caused by vehicle crash or vehicle collapse or vehicle run over or turn over or something like that. So this is the underlying cause. It is not the trauma itself. The resulting trauma from the crash is not the underlying cause. We will discuss this in details. We have two types of death: the natural death and the accidental death. The unnatural death, we got an example for natural death, and now the accidental death. We have in the coding system of ICD-10, there is a code S and code T for trauma. Okay, but if you have RTA, or if you have some sort of trauma and the patient died at the end, the trauma resulted from the injury. It is not the underlying cause. So the patient has RTA, and the RTA caused fracture skull, and the fracture skull caused intracranial hemorrhage, and the intracranial hemorrhage caused death. So the fracture skull is not the underlying cause. The underlying cause is the mechanism of injury happened to the patient. So we will not use the S and T codes, we will use the V codes as it is explained here. Underlying cause of death in injury, poisoning, and certain other consequences of external causes according to the type of transportation accident. Reassign to V01 to Y89 external factors as underlying cause. Don't use S0 to T98 as underlying cause of death. This is the list as examples of how the underlying cause in trauma can be selected and accepted codes. Okay. Also for accidental death, like in drowning, like in fire, like in burn, also we will not use the trauma codes like S and T. We'll use other codes as underlying cause of death is X in burn, X0 to X09, exposure to smoke, fire, and flames, X76, intentional self-harm by smoke, fire, and flame, X97, assault by smoke, fire, and flame, and Y26, exposure to smoke, fire, and flame, undetermined intent. Also for drowning, we will not use S and T codes, we will use W, X, and Y. W, accidental drowning and submersion, X, intentional self-harm by drowning and submersion, X92, assault by drowning and submersion, and Y21, drowning and submersion, undetermined intent. The last one is death by intoxication, overdose, or effect of drugs. We will use the X and Y. Underlying cause of death according to the manner of the death: accidental poisoning by and exposure to other and unspecified drug, medication, and biological substance. X60 to 69 intentional self-harm by poisoning, and Y10 to Y19 event of undetermined intent of poisoning by whatever drug or biological substance. Actually, we received a list from forensic medicine department providing us with a list of prohibited codes which is not suitable to be used as underlying cause of death. We are we discussed these points with them. Actually, it is not from the side of forensic medicine. It is internationally applied protocol, and there is a list from WHO. The owner of the ICD-10 listed the same prohibited codes not to be used as underlying cause of death. So it is not something locally, it is not nationally, it is internationally from WHO and the owners of the ICD-10 coding system. Okay, for further reading, we can browse the WHO website with the underlying cause of death or the ICD-10 codes with this helpful instruction to use the ICD-10 WHO International ICD-10 code with the coding of a disease and the coding of underlying code of death and the prohibited and accepted codes to be used as underlying cause of death. At the end, I want to thank Dr. Mamdouh Zaki. I borrow his slides to be used today in this short presentation. If you have any question, it is very welcome to contact me and to send the questions, and I will try to get the proper answer for you. Thank you so much.